My name is Todd Irwin. I'm an orthopedic foot and ankle specialist at OrthoCarolina. I work out of the Foot and Ankle Institute here in downtown Charlotte, as well as the Matthews office and the South Park office. We see all kinds of foot and ankle problems, everything from just below the knee down to the toes. The foot and ankle is actually very complex. The ankle joint itself controls the up and down motion of the foot as it relates to the leg. The other joints below the ankle, there's 3 other joints that we talk about, including the subtalar joint, really help with the side-to-side motion of the foot. That relates to things like uneven ground. And as you go out further into the foot, there's a lot of rigid midfoot joints. Then we get out towards the toes, in particular the big toe joint. One of the more common things we see is arthritis of the big toe joint. Very, very common problem that is important to recognize and understand the anatomy and how that relates to their function. If a patient comes in with a chronic condition such as a bunion, they have pain from a bunion, typically starts with a really good history and physical and doing a good thorough examination. And then we typically start with radiographs or x-rays, and we like to show the patient what those images show and correlate them with what the physical exam is. So we have to put all those data points together to figure out what the problem is and then come up with a treatment plan after that. An athletic type injury is going to be more of an acute injury that would be more like a sprain or even a fracture of the ankle, a lot of pain and swelling right off the bat, versus a chronic wear and tear is going to be more of a sort of a dull, achy pain that could come in the middle of the foot or in the front of the ankle, certainly worse with activity, sometimes first getting up out of bed in the morning. That's more of a wear and tear or arthritic type condition. We see arthritis in several different areas around the foot and ankle. Arthritis is really just a loss of cartilage, which leads to bone rubbing on bone. In general, for arthritis, there's a handful of treatment options that we can proceed with. Pretty much for any arthritis, an anti-inflammatory medicine can be very helpful to help with the symptoms. We often start with some type of ankle brace or immobilization. If patients don't respond to simple things like anti-inflammatories, bracing, some other options would be cortisone injections, both to determine where the pain is coming from, as well as to give the patient some relief. If patients aren't responding to simple treatments, if it's affecting their ability to do things they like to do, that's when we start talking about possible surgical intervention for the arthritis. A lot of patients come in with pain after a small injury, and sometimes we will see sprains, which is really a stretch of a ligament. It could happen in the ankle, it could happen in the midfoot, or even out in the toes. You can sprain the ligaments of the joint itself. Versus another injury that is pretty common is a stress fracture. What that is more of a acute repetitive stress on a bone itself that can lead to kind of a microscopic fracture. Those are a couple of aspects of injuries that may present in a similar fashion and look similar, but are quite different in terms of the anatomy that is injured. Some of the imaging that we get is an MRI scan versus a CT scan. A CT scan is a more high-powered X-ray for us, and it gives us a lot of detail about the bone and the joints and whether or not there are bone spurs or arthritis or sometimes occult or hidden fractures that weren't necessarily seen by the X-ray. An MRI scan for us gives us more detail on the soft tissues, which include the ligaments, tendon injury, as well as if there's something going on inside the bone, such as edema or swelling or inflammation inside the bone, which can give us, again, more information about what the true problem is. Edema essentially means swelling, and so if someone has an injury, you might have a swollen ankle from an ankle sprain, so that's considered soft tissue edema. But we also see bone edema. You have an injury to a ligament, but the ligament actually pulls off the bone, and you can't see that on an X-ray, but on an MRI, you're going to have some increased signal. So whereas it might look dark in a normal bone on the MRI, it'll light up and be white. We call that bone edema, which again, can indicate inflammation or injury or even arthritis. Bunions are another very common problem that many patients think they need surgery for, but don't always need it unless they're having significant pain. There are many different surgical treatment options, and it really depends on how severe the bunion is, both on x-ray and how severe their pain is. Orthotics are inserts that are put into shoes to either correct a problem or just treat symptoms. Orthotics can be very helpful, but they should be used to treat specific problems and specific symptoms.
Many of you might have had an orthotic that's made in the past. We've had some newer technology recently that we use at our office in Winston-Salem. We have a pressure mat, and we have the patients walk over the mat for about 5 minutes. The computer then collects data points, and that gets sent off to the orthotic company, and then the orthotics are 3D printed based off of that data.
If someone does have a very flat foot and that's causing pain on the outside part of the ankle, an arch support built into an orthotic can help offload that area. So we've covered many of the common ailments and complexities of the foot and ankle. We feel very confident at the OrthoCarolina Foot and Ankle Institute that we can treat these and really address any of the problems that you may have. Please reach out to us and make an appointment online, and we will get you in for further evaluation. Thank you.